Hello, welcome back to my channel. It's still your girl, Nurse Nancy Uzo. If you're new to my channel, thank you for dropping by. To my returning subscribers, you guys are the best. Thank you for always coming back. I love you all. Today we'll be looking at type 1 diabetes, which was formerly known as juvenile diabetes, and insulin-dependent diabetes. This is a chronic autoimmune disorder that prevents your pancreas from making insulin. This pancreas is a long gland located at the back of the abdomen, that's your belly. This gland is part of the digestive system and endocrine system. It makes enzymes that helps in digestion and hormones that helps regulate the amount of sugar in the bloodstream. Insulin is an important hormone that regulates the amount of glucose in your bloodstream. Under normal circumstances, insulin functions in the following ways. First step is that your body breaks down the food you eat into glucose, which is your body's main source of energy. Second step is that this glucose enters your bloodstream, which signals to the pancreas to release insulin. The third step is that insulin helps glucose in the bloodstream enter your muscle, fat, and liver cells so that they can use it for energy or store it for later use. When glucose enters your cells and the levels in your bloodstream decreases, it signals to the pancreas to stop producing insulin. If you do not have enough insulin, too much sugar builds up in your bloodstream, causing hyperglycemia, and your body cannot use the food you eat for energy. This can lead to serious problem or even death if not treated. People with type 1 diabetes need synthetic insulin every day in order to live and be healthy. Who does type 1 diabetes affect? Anyone at any age can develop type 1 diabetes, though the most common age at diagnosis is between 4 to 6 years or early puberty, that is 10 to 16 years. It affects people assigned female at birth and male at birth almost equally. While you don't have to have a family member with type 1 diabetes to develop this diabetes, having a first degree family member with type 1 diabetes can increase your risk. How common is type 1 diabetes? Type 1 diabetes is relatively common. It is one of the common diseases that affects children in US, although adults can be diagnosed of it as well. What are the symptoms of this type 1 diabetes? The symptoms typically start mild and can progressively get worse or intense, which can take several days, weeks, or months. That is because the pancreas produces less and less insulin. So here are the symptoms: excessive thirst, frequent urination, including excessively filled diapers and bedwetting in children, excessive hunger, unexplained weight loss, slow healing of cuts or sores, blood visions, fatigue, and vaginal yeast infections. If you or your child have any of these symptoms mentioned, it is advisable you visit your healthcare provider to get tested for type 1 diabetes, because the earlier you get diagnosed, the better. If your diagnosis is delayed or untreated, type 1 diabetes can be life-threatening due to a complication known as diabetes-related ketoacidosis. That's a topic for another day. Seek emergency medical care if you or your child is experiencing any of the following combination symptoms: fruity smelling breath, abdominal pain, that is belly pain, rapid breathing, confusion, drowsiness, and loss of consciousness.